Women need to know sooner about their fertility potential. They need to understand about their reproductive health. They need to understand that there are a lot of factors that play into their fertility potential. So often we hear from women who have gone through infertility, "No one told me. I didn't know this. Why didn't I know any of this? Why me?" We have a patient population that in many ways is underinformed, and underinformed not only about fertility and infertility, but their own health and some of the things that, warning signs perhaps that they had earlier or younger that would have made a huge difference in their ability to have a child. It's a very silent disease. It's also very emotionally taxing on women, both in their relationships, in their friendships, family dynamics. It touches on so many facets of their life, and yet despite the fact that 1 in 8 couples have infertility, women generally will tell us, "I don't have any friends that are going through this. I don't have anybody to talk to." And it's oftentimes because no one has opened up and shared. The CDC says that in any given 12-month period, 2 million married women have sought out some sort of medical assistance for infertility. In general, there's 7.3 million couples with infertility. That amounts to 1 in 8 couples, so it's about 12% of the population in their reproductive ages. So it's very prevalent in this country, and yet there's so little we know about who really gets infertility, which is surprising considering the prevalence. It is a medical disease that deserves all of the attention, both from our government, our health organizations, medical organizations, and the community at large in terms of awareness and correct information about it. If we can get more women going in, asking the right questions, and really pushing their primary care physicians, in some cases it's an OBGYN, "Hey, what about my fertility? Am I at risk? Should I be thinking about some of these things?" I think that's a very solid message that we could be giving women in general around the country. And oftentimes, it's patients doing that that gets the practitioners to change. If we could change the whole dynamics and get women understanding their health, their reproductive health, and their fertility potential at a far younger age, I think that's going to make a profound impact on outcomes on the entire field.